Hello everyone and welcome to Ask an Expert. Today's guest is Dr. Jessica Adams, Chief Medical Officer at Alfardan Medical with Northwestern Medicine. Dr. Jessica, welcome to Ask an Expert. We are very happy to have you with us.
Thank you. Thank you so much for being with us here today at AMNM.
We are very happy to be. So doctor, tell us more about Alfardan Medical with Northwestern Medicine.
Sure, be happy to. We're really excited about Alfardan Medical with Northwestern. We are a partnership between two big organizations, Alfardan Group, which I'm sure everyone in your audience is well aware of, and they partnered with Northwestern Medicine, which is a top 10 U.S. healthcare system, to produce us, Alfardan Medical with Northwestern Medicine. So we are an ambulatory day center, so we do day surgeries, and we have a variety of outpatient clinics ready to serve the people of Qatar.
Now we are having this interview in your executive health suite.
Yes.
Could you tell us more about this program?
Yes. Well, we love these beautiful suites. This is part of our program, Executive Health Program. So this is a half day or maybe a little bit longer than a half day program where an individual can get almost most of their yearly health needs done in one visit.
Okay.
It starts with a pre-call with the doctor to kind of prioritize your health needs. We schedule a beautiful day in a nice setting with beautiful lunch and be able to see the doctors you need to, all in a pretty condensed amount of time. So it's really good.
How long does it take?
It varies, the packages vary, but somewhere between 4 to 6 hours.
Okay,
Yeah.
so it's basically an entire day where you check all things. What are the tests that you do?
We do a lot of baseline tests. We do lab work, we do a physical exam, there's an assessment with a nutritionist, we have an exercise physiologist who can help do an exercise plan. So it's quite comprehensive. We're looking to be preventive, to look for any diseases that might be brewing that you might not have known about so that we can prevent them from getting worse and help people live longer lives.
So this is preventive medicine.
Definitely it is, but we're happy to also manage any known chronic conditions as well. But we want a comprehensive, rather holistic view of the patient in really a lovely setting.
Great, that's a good idea. Now we are going to talk about blood pressure. We notice that many people after having blood pressure, they also have diabetes. Are these two diseases related or do they have some links to each other?
They do. You've definitely picked up on a very common theme. These are two kind of naughty diseases that go hand in hand often. A lot of times, in fact, when a type 2 diabetic is diagnosed, over half the time, they already have high blood pressure at the same time.
Yes.
So we do find them together. Unfortunately, they have a similar set of risk factors. So physical inactivity, smoking, family history, drinking, poor diet. A lot of these risk factors are the same for both high blood pressure and for diabetes. And we do know they kind of work together in the body to do more damage. In fact, diabetes can damage the inner part of the blood vessels, which causes thickening or hardening, and that then worsens the high blood pressure. Conversely, also, if you have diabetes and hypertension, the hypertension makes the diabetes consequences even worse. So they work together, they often come together, they have a similar set of risk factors. Unfortunately, they have a similar set of bad consequences, like heart disease and stroke.
Okay, so then what is insulin resistance? Could you explain to us more?
Sure, it's kind of a fancy term. It's a little bit intimidating, right? But essentially, when you eat your food, it goes through your mouth, into your stomach, and at some point it gets into your small intestine, then it gets absorbed into the blood. Now, the sugar really shouldn't be in the blood. It needs to get into the cells of your brain or the cells of your muscles, so you can lift your baby or think, do the tasks your body needs to do. And in order for the sugar, which is in the bloodstream, to get from the bloodstream into the cell of the organ in which it needs to be, something needs to kind of trigger that. It's called a hormone, a chemical messenger. And insulin is in fact that hormone. Insulin is made in the pancreas and it goes and it's like a knock on the door. Hey cell, open up, I've got some sugar for you. And if everything works right, the cell should open up, that sugar gets into the cell, it's like gasoline or fuel. It can do the work that your body needs to do. The problem with insulin resistance is that over time, from a variety of things, actually a lot of the same things I just mentioned, physical inactivity, poor diet, a lack of exercise, maybe family history, the cell starts to become less responsive to the insulin. It's just ignoring it. It doesn't really hear that knock on the door saying, let that sugar in.
That's where the word resistance comes from.
Exactly. It just stops listening to it. It just ignores it. It just puts it on mute. And so then that sugar hangs out in the blood where it's not supposed to be. The sugar should get to where it needs to be. So then it starts traveling throughout your body and it goes to the places that it's not really supposed to be. It loves the ends of nerve root endings, like in your feet, and it starts to damage those nerves. And those nerves over time will become less sensitive and, for example, can cause damage to your feet. Can go to the back of your eye, a variety of other places. So over time, this resistance can become even more overt, more frankly bad, and become diabetes, in fact. And so it's part of the spectrum until you get to the consequence of diabetes. And then over time, that sugar causes even more problems.
So then let's move to the most important advice that you would give people to avoid these diseases.
Well, it's a lot of the same advice everyone probably knows already, right? A healthy diet, great exercise, good sleep, managing your stress. We do know that chronic stress can really worsen these two diseases. And really, you need to know you have a problem, hopefully, right before it starts, right?
Yes.
So if you do these healthy things I just mentioned, that should go a long way. The other thing that's important is that you see your doctor regularly to catch any kind of early high blood pressure or early insulin resistance
Yes.
like we're talking about.
To be able to detect it, actually.
Exactly. And in that way, that's how we can prevent them from getting worse.
Yes.
So if you know your numbers, what's my sugar, what's my high blood pressure, these things
You'll
can
be
help.
able to, yes.
Exactly.
Yeah,
exactly.
okay.
Yeah.
Now, a lot of people are wondering, how do you take care of your patients during COVID-19 and all the restrictions?
COVID has changed everything,
Yes,
hasn't it?
it has.
It's upended all of our lives in so many different ways, and it's impacted our ability to take care of patients. So, of course, we're having a pretty serious COVID outbreak. The country has responded appropriately. They're taking great care of our patients in the hospitals. What we offer here is we can do telemedicine visits. So this may be something that a lot of people aren't really familiar with. It's new but gaining in popularity. Unfortunately, COVID has made us creative to come up with a new way to see patients.
Yeah.
So that's just like a virtual visit, a video conference call. So you might call me, we'll see each other.
From home.
Exactly, in your jammies, relaxed, comfortable, convenient, and we can have a
Safe
discussion.
also, yeah.
Exactly. So it decreases your hanging out with other people, which can decrease your risk of COVID. But that way you and I can discuss any issues, chronic medical conditions, we can adjust the medicines. If you have diabetes, we can talk about that over the phone, over the conference call, and adjust medicines if necessary. So we can manage a lot of minor complaints, even chronic conditions, and help people stay healthy and safe despite these turbulent times.
Yes, great. Thank you so much for this precious information and for your time.
Thank you.
And thank you so much for watching. We'll see you in the next episode of Ask an Expert.
Thank you so much.